Hello, Mr. Peasley. I am going to be talking to the audience of the parents of the children undergoing gender-affirming hormonal therapy, and I will be using inductive reasoning. Ladies and gentlemen, esteemed parents, I have come to you tonight to talk about a subject of paramount importance: the growing demand for gender-affirming hormonal therapy amongst the youth. The quest for identity acceptance is a sensitive topic. While we can emphasize the struggles of teens questioning gender identity, we must carefully consider the potential repercussions of allowing life-altering decisions at such a young age. First and foremost, life-changing properties and high accessibility of gender-affirming hormonal therapy for minors can cause some concern. Imagine your 10-year-old kid comes up to you and asks for a forehead tattoo. The permanence of this tattoo resembles that of gender-affirming hormonal therapy, which is usually started at the first signs of puberty. At this age, the minds of our children are not fully developed and able to make decisions with such enduring consequences. Based on our own childhoods, can we really support decisions made in youthful impulsivity? A study by Sarah C.J. Jorgensen reveals that parental influence, often driven by personal values, is a significant factor in pushing these adolescents to transition. In addition, the irreversibility of certain physical aspects like breast growth and infertility can add to the psychological distress of our teens. Moreover, gender-affirming hormonal therapy, or GAHT, for minors poses numerous health risks, including but not limited to heart problems, weight gain, infertility, and type 2 diabetes. The Mayo Clinic highlights the potential cardiovascular consequences, including blood clots, high triglyceride levels, high potassium levels, and high blood pressure. Melissa Yalihi's studies underscore the heightened risk of myocardial infarction in transgender women undergoing hormonal therapy. As responsible parents, can you, in good conscience, allow your children to undertake treatments that drastically increase the likelihood of life-threatening health issues? While some people argue that GAHT offers mental health benefits to the transgender community, it is imperative to acknowledge the lack of comprehensive long-term research. Rita Kertu-Katiala's study on the psychological outcomes for GAHT for minors does indicate a decrease in the need for specialist psychiatric treatment. However, the limited number of studies raises concerns about the overall safety and efficacy of these measures. Placing the mental well-being of our children in the balance demands a cautious approach, especially when normal psychological aid is possible. Furthermore, the normalization for gender-affirming hormonal therapy for minors may inadvertently stigmatize those who choose to not undergo physical gender changes. The high accessibility of hormonal therapy raises concerns about societal pressure and expectations. Laura Bam's study on perceived stigmatization highlights the negative impact on mental well-being for those who deviate from gender norms. Subjecting our youth to potential stigmatization, peer pressure, and societal expectations at such a vulnerable age may have far-reaching consequences, toppling the struggles they already have. In conclusion, the ethical, the social, and the health concerns surrounding GAHT for minors compel us to want it to go further. Adolescents still in the process of mass maturation may lack the cognitive and emotional capacity to make decisions with lasting consequences. The alarming health risks associated with hormonal therapy further underline the need for caution. Additionally, the potential for stigmatization against those who do not conform to gender norms challenges the very fabric of inclusivity and acceptance we strive to build in our society. As we contemplate this issue, let us imagine a scenario where a 12-year-old wishes to become a pirate. Would you let them undergo surgery to remove their leg? The analogy may seem extreme, but it prompts us to consider the gravity of decisions made in the realm of identity and self-expression. Let us approach this matter with empathy, careful consideration, and a commitment to the well-being of your children, recognizing the significance of their journey to self-discovery, while safeguarding them from irreversible choices that may have lasting consequences. Thank you for your time. Have a good night.